Always watching out for your health. And according to the CDC, kidney disease is the 10th leading cause of death. In Illinois alone, 4,000 people are waiting for organ transplants, and more than 85% of them are waiting for kidneys. That is why there is such a huge campaign right now across the state of Illinois to bring awareness to kidney disease and prevention. Dr. Anuja Java from Washington University joins us to talk about the National Kidney Foundation's campaign. First, though, help us really understand what is kidney disease and what causes it on the most basic level.
Definitely. Thanks for having me here, Paige, today. I think it's a very, very important topic. So kidney disease is any condition that damages the kidney such that the kidney cannot function to maintain healthy living in patients. And the kidneys cannot do their job. They cannot get rid of toxins, cannot get rid of excess salt and water. And there are multiple reasons that cause kidney disease, high blood pressure and diabetes being the two main reasons that affect about 75 to 80% of patients. And other than that, there are multiple other causes, genetic reasons, inherited diseases like polycystic kidney disease, kidney stones, infections, autoimmune diseases like lupus, taking a number of over-the-counter medications. There are multiple reasons, but high blood pressure and diabetes being the number one cause.
Well, what are some of the signs and symptoms? Because I understand it is sometimes called a silent killer.
Right, absolutely. And it is a silent killer. And what a lot of people don't understand is that in the early stages of kidney disease, there actually are no signs and symptoms. It is only in the late stages that patients actually start developing something, and that is during stages 4 and 5, and that is close to end-stage kidney disease or kidney failure when patients need dialysis. During that time, patients may have symptoms like fatigue, tiredness, lack of appetite, loss of taste. They may noticing swelling in their feet or ankles or puffiness in the eyes, but in the early stages, there are no symptoms, which is why it's called a silent killer.
Why are the African American, Hispanic, and Asian communities so significantly impacted by this?
Right, I'm glad you brought that point up, Paige. So, as I said, high blood pressure and diabetes are the number one reason for kidney disease. And the African Americans, Hispanic, and Asian communities are more predisposed to developing high blood pressure and diabetes. Now, part of the reason is genetics, which means that they are more genetically predisposed to developing high blood pressure. However, a major component is also socioeconomic factors, or what we know as social determinants of health. So not having the education or the awareness that they are at higher risk, not having access to resources, simple things like transportation, not being able to have insurance, lack of utilities, clean water, clean air. So there are a number of social factors in addition to the genetics that predisposes communities of color to being impacted with kidney disease heavily. And I do want to add here that primarily for this reason, the National Kidney Foundation of Illinois launched their campaign, the Kidney Health for Life, where they are promoting awareness and education to communities of color so as to provide them with resources and help them navigate some of these issues, and also provide an emotional network for them.
Well, thank you for joining us to really explain what I think can be intimidating, even though we hear so many people are dealing with it. So thank you for helping us learn more about it. And you at home can learn more about Kidney Health for Life's campaign by visiting nkfi.org. Technology